I was talking just before about microfinancing, that a lot of women are the ones who are taking on microfinancing and making a difference. And men and the patriarchy, which has been dominant for so many centuries, they don't do as well, do they? It just don't seem to do as well. Women do better.
True, yes. And even we've seen that happening. And basically, through the work that we've been doing at Care International, we've seen actually economic empowerment of women playing a very critical role in addressing some of the injustices that women and girls go through. So looking back, even when we try and look at the way the society actually was able to support women in regards to really emancipating themselves from social injustices and even poverty as a whole. Actually, economic empowerment has played a very, very important role. And as Care International, we've had quite diverse programs that even look at supporting women to really improve the economic viability, and even starting up some of those microfinance opportunities, businesses, growing them, and really ensuring they have resources to really use, not only having resources, but controlling also those resources. It's a very important part of really supporting women and girls back here in Kenya and even in Africa. So I totally agree, yes, economic empowerment has played a very big role, or trying to bring women up and even helping them to fight and even address some of the injustices that they face because of lack of resources or even access and control to those resources.
Well, excellent. That's good to hear. Now, COVID situation, what is it generally like in Kenya, in Nairobi at the moment? Is it the same as the UK?
I believe so, but maybe a few differences because of the context that we are operating in. I believe Nairobi and Kenya as a whole, actually, we've been able to now go into the recovery season. I'll call it a season of post-COVID, because last year was really, really tough, Ed, to be sincere. Yeah. And we experienced one of the worst years so far in the country. And we went into the lockdowns, the containment measures. Things went completely down, and women and girls were disproportionately affected by the entire pandemic. And currently, we've seen actually in this year 2021, things have started opening up. For example, schools have reopened. We had just school reopening the last 2 weeks. Actually, schools have gone back into the normal academic calendar. And we've seen also other restrictions being lifted a bit, and people going back to the new normal, actually. Going back to work, people going to open up their businesses again, traveling actually resuming. We can hear flights, actually planes flying out of our airport. Actually, we've seen people traveling now, going back to do their businesses as they were. But we are still afraid. We are still afraid when we hear that actually second waves have started hitting countries that had opened up. And for us, we are really also anxious, not knowing exactly what will happen, because after opening up is when the second wave comes in. So for us, we are just trying to be very optimistic, cautious, and trying to really, really work through all the guidelines that have been provided to us by the Ministry of Health, by the security teams in the country, and any containment measures that have been put there, public health guidelines, to really help us not to sink into the second wave, because it will be so hard for us. Already we have a very strained healthcare system, and we cannot afford to really go there. Already there are so many other things that are really happening currently in the country that cannot afford to be locked again or be contained again, because the economy is already doing very badly, and we really want things to really continue working out for each and every body in the country. So that is the situation in Nairobi, but it's a warm situation, I will say, because everything is opening up, and we believe it should continue like that.
Okay, okay, well, that's good to know. Well, hopefully yours will get better. Ours is trying to get better, but we're stuck at the moment. It feels. And tell us about. We have the same problem in the UK, gender-based violence in Kenya during lockdown, which would also has been happening in the UK, domestic violence. Tell us about the situation there.
Yes, so basically, when COVID hit the country, that is when the first case was announced on the 13th March of 2020, the country actually later, 1 week later, announced measures that actually included restriction of movements, people going back into their homes. Nobody was actually allowed to move out. And this one actually provided a very, very fertile ground for domestic violence because there were no opportunities for even victims or even survivors to come out and either seek support, seek refuge. This meant that a lot of women and girls actually were in the hands of either their violators or were in situations that were really compromising on how they can be able to either get out of abusive relationships or even get out of a situation that will expose them to abuse. And this is the reason why we are saying that this actually became a shadow pandemic, whereby apart from the suffering that actually the entire society was afraid of getting infected with the coronavirus, trying to really work around the public health measures of trying not to get infected or going to hospital if at all you are infected, people were suffering in silence, especially women and girls. And now it became a wake-up call for everybody to come out and start calling out the violence that were going on. And
Yeah.
so there was a lot of intimate partner violence, issues to do with physical assault and abuse. We've experienced even, unfortunately, deaths of people actually who are dying in the hands of either their intimate partners and even others who actually sustained either injuries or even medical issues through gender-based violence. Another form of violence that actually was really rampant was issues to do with economic gender-based violence, whereby a lot of households were not able to continue providing for themselves. And we found quite a lot of households even deciding somehow to relocate again from the cities. We found a massive relocation once the country reopened briefly after the containment measures were opened up. There was a mass exodus of families from the city, especially in formal settlements in the country, cities, to their rural homes. Their rural homes actually became like a refuge for them during this pandemic. So those are the forms of violence that we've been able to see and even document around. And I would not want to forget mentioning issues to do with mental health and also psychosocial issues. There was a lot of anxiety. People are still experiencing even that right now, a lot of anxiety. People being actually contained in their homes, and some of the people are not used to that environment. So it really brought a lot of issues, and even we had people, organizations, and we work with a lot of women rights organizations, grassroots organizations that were recording those cases, supporting them. And this actually showed there was an increase in gender-based violence within Kenya during the pandemic.
Oh, that's a tough old situation. So I'm sorry that you've been going through all that. But with regards to yourself, do you? I'm obviously running on a treadmill now. Are you able to? Have you been able to keep fit and healthy yourself? Are you someone who takes exercise in your daily life?
Yes, I do. I do actually. I'm not a very strong enthusiast of exercises, but during the pandemic, I had to really change my lifestyle. One, I was taking walks every evening because of being locked in. And in my neighborhood, I could walk out and even take my two little girls outside so that we could take a walk together and then come back. Then also I decided to start exercising in the morning, but in the house. And basically, that one really helped me to cope even during and after. I have found myself more healthier. My mind actually is more open and energetic, and even very ready to cope up with some of the challenges that were coming in. So exercise has been a very, very instrumental part of my coping mechanism. And I'm happy to see you also doing this for this noble cause. Trust me, I'm really, really excited, and I really appreciate you for that, Eddie, and looking forward to even seeing you on the treadmill even further and cheering you on. And myself, I'll also go on the treadmill and try and really be in the spirit with you for the same.
Well, thank you very much, Dorothy. You have the same name as my mother. My mother was Dorothy Izzard, so it's a very good name that you have. So I just want to tell
Wow,
you that.
thank you so much to know that, and I really appreciate that also
No,
comment from you.
it's nice. But I'm going to let you go now. Thank you for talking. But sorry, the link didn't quite work, but we could hear what you were saying. And it's great to know that professionals like yourself, young girls, boys and girls, can come up and go through and go to universities and get in and be really helping, especially with young girls and women generally, to get a stronger voice, to be able to be strong in society in Kenya. So thank you for talking to us. Stay safe and be well.
Thank you very much, and all the very best, and stay safe too. And we continue being the voice and not the echo.